So we're back for our last segment. I always like to talk a little bit about how doctors achieve work and life balance. And if you tell me I have, you'll be the first doctors to tell me this. So what do you do to try to get that work-life balance in your lives?
Jana, you go first. I feel like you probably have this better than I do.
Yeah, it takes work. I think liking what you do is really important, because then when you have to leave your family to go and do what you are supposed to do, then you're not so, upset about it. Having a really good partner, good childcare can be really helpful. And then exercise, I think, plays a really important role too in finding that balance. Just kind of like centering you and taking your mind off things while taking care of your body, I think is really important.
I think it took me COVID. That's like one of the positives for me that came out of COVID. It's only been a few positives out of COVID. But I think things slowed down enough initially with COVID that I realized how tired and how much I was working and giving. And something felt very normal about having dinner with my family every night. And I was like, oh, we need to figure out how to hold on to just a little bit of this and not every night having a kid in some sort of activity. So after COVID, we said, okay, one activity at a time for each of you. So I feel like we've done a better job. And I've done a better job with modifying my schedule and honestly being okay with saying no. Like, I felt like I would always go to all of the, dinners that came up. And so now it's like, oh, it's okay to be like, you know what, actually, I'm going to go home and spend time with my family. So we have to be very intentional and I think do a better job of planning. But I do agree, you can't do it without a supportive partner. And so I think we definitely have to give credit to our partners in our family, because my mother also lives with us. So I don't think that it would be possible without my husband and my mother, who really make it possible for us to have good balance in my household, at least. Yeah.
So you're able to find time for, you have 3 children, you have 2 children. Mm-hmm. That's a lot of children. So, and children, being a former child myself, I know how demanding we can be. So how do you make all that work? In 25 words or less.
So I think it's important to have time with each of them. So I usually start like at night, right? Like you get home and you have dinner. And then I start with the youngest. And so that's our one-on-one time and work my way to my middle child and then my oldest. But my oldest is now 16. So his time is kind of like, But I feel like up until like 14, he always looked forward to his quality time still. And he'd come lay on our bed and tell us about his day. And so I try and make sure I have time with them individually. And then after that is my husband's time. Like we have time together as well after the kids. But it's hard to find just the right balance. But I feel like the kids this is all they know, right? Yeah. Like sometimes, we put a lot of guilt on ourselves, I feel like, as mothers, and we feel like we don't spend enough time with them. But then they don't know otherwise. Like this is their normal. Yeah. And so I remember asking my 16-year-old, I was like, do you think I should, spend more time at home? And he was like, I don't know. He said, this is his normal. So they're content with, the time that they have. They don't know otherwise.
Mm. Yeah. Yeah, I think they know that you can't go to every single game or every single event, but that you try your best and try to make the most of it and be present when you're there.
Now, Dr. Mudd, you mentioned your roots go back to the Netherlands. I was wondering, are you any relation to Johan van Galen, who was a Dutch naval Commodore of the 17th century, First Anglo-Dutch War?
I might be. I know we were related to a famous Dutch sea captain, so maybe that's him. But my dad would probably know the history a little bit better than I would.
All right, well, you have to find out from your dad, and then you'll be back on the next show, and he'll tell us.
I thought you were going to ask if I was related to the infamous Dr. Mudd. I get asked that sometimes, too.
Well,
but that's through marriage, but yes.
And you've gotten some time to go visit the Netherlands? You've been back, and what's that been like?
Oh, it's good. Used to visit my grandmother, who unfortunately passed away a few years ago, but my dad's one of 11, so I have plenty of cousins over there.
Big family.
Yeah, it's always nice to go back.
Oh. Now, Dr. Anderson-Tull, I understand you enjoy butter pecan ice cream. Now, there's a story that coincides with our national observance of Black History Month relevant to butter pecan ice cream. Can you relate what that story is, your connection to that, and why you like it?
I only recently learned about the history behind butter pecan ice cream. So I've always liked butter pecan ice cream, but maybe there is some like genetic drift there that, drove my affinity to it. But I only recently learned in history that African Americans weren't allowed to have vanilla ice cream. And so they added pecans to it. So then we were allowed to have butter pecan ice cream. And so I was like, oh, well, maybe that's why I like butter pecan ice cream so much.
Well, it's a good flavor. It's my father's favorite, and so it's a good one. Dr. Anderson-Tull, Dr. Mudd, I want to thank you both for your time and your candor. I'm hoping people enjoyed to have this opportunity to learn a little bit more about you, learn some stories, have some fun, and hopefully maybe learn a thing or two they can apply to their daily lives. And Thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you. So you made it through the credits for Wait, Doctor, I Forgot to Ask. This is where we briefly discuss the question each physician wishes their patients would ask, but don't, or the most unusual hand on the doorknob question posed by a patient at the end of their visit. Okay, what are those questions?
Ooh, that one's hard.
Yeah.
Yeah.
We get two options here.
Well, I will say I did a year of family medicine before coming to OB, and I think because as primary care providers, they get that the most. The very first thing that I learned as an intern was to ask, when you walk in the room, ask the questions, ask the patient, do you have any questions, concerns, or things you'd like to address today? And so I think that's helped. Do I still get that hand knob on the door? Sometimes, but not nearly as much, because I always start, I feel like as doctors, a lot of times we walk in and we have a list of questions for the patients and things that we would like to address at the visit. But I usually start with what questions and concerns they have. And most of our patients nowadays, they'll pull out their phone and they have their list. So I usually do their list first, because I can get through mine faster than getting through theirs.
With regards to having a baby, some people just sort of have no clue like what it's going to be like and what it's like to deliver and to stay at the hospital. So that sometimes is the hand on the doorknob question, like, well, what is it actually going to be like when I'm there? So that's a nice thing to be able to talk to people so they feel more comfortable about, what it's going to be like when they have their baby.
That seems to me that would be a good thing for, to have, whether it's a handout or something where it's like, okay, we're going to hit all these bullet points. These are the things you should, like, make sure you bring this with you, make sure you have this or that.
Oh, yeah, we have a really thick one.
Yes, we have one of those.
So you have that opportunity to go over your patients with that sort of thing. That's a
Or I
great
guess
idea.
one thing I would say I wish that they kind of knew for our OB patients is that when they make their birth plan, that we don't have any control over it. They don't have any control over it. It's really their baby that's in charge. I feel like that's your first lesson as a parent, that, the little one's in charge here, that it doesn't always go according to the plan just because we wrote the plan, that we made this plan, and that I think some people come thinking like it's going to be exactly, the way they wrote it.
Thank you both.
Yeah, you're welcome. Thank you for having us.
Thank you.